So I have been a patient advocate for over 25 years. My first child, Evan, was born in August of 1994. My husband and I were so happy that after 9 long months of anticipation, we were blessed with a beautiful and healthy child. After several months, visits to numerous doctors, and endless tests, Evan was diagnosed with Tay Sachs disease. This not only devastated us, but shocked us since I was tested for Tay Sachs during my pregnancy and told that I wasn't a carrier. I immediately contacted my OBGYN, who, upon re examining my records, discovered that I had actually tested positive as a Tay Sachs carrier. We now have three other healthy children. With each of my pregnancies, I updated my carrier screening for diseases that were added to the panel. Knowing that my husband and I were both carriers of Tay Sachs disease, we were able to make family planning choices that enabled us to have healthy children. From the bottom of my heart, I believe that every couple should be able to make educated decisions based on accurate genetic information. I've been working on the mission of education and awareness about carrier screening for over 25 years. Having a child with the rare disease made me recognize the importance of raising awareness not only about the disease, but also about the importance of carrier screening. It is essential that everyone who is planning to start or add to their family seek preconception carrier screening along with genetic counseling to determine if they're at risk of having a child with one of these horrific diseases. So, equitable carrier screening, or as so many people know it, expanded or pan-ethnic carrier screening, benefits families because they're able to understand their genetic conditions, or everyone is a carrier of some type of genetic mutation, so they're able to understand what they're a carrier for. So we want to make sure that insurance is covering any and all genetic testing when it comes to family planning. So I've been involved with policymakers by sharing my story. I want all policymakers to understand the impact of a family having a child with a rare genetic disease. I want them to be aware that this doesn't have to happen, that coverage for genetic testing coupled with genetic counseling is vital. It can save lives and it can help families and spare them from the suffering that we experienced.